Welcome to CareTalk, your virtual home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
John, everybody's asking the same question. When will the economy reopen? Now, some people are advocating for a fixed date, and other people are saying, nope, we can't have a fixed date. We have to check off certain conditions. Let's talk about the fixed date first. What is this about a fixed date? Who's suggesting that? What does it mean? Is it a good idea?
Well, I think everybody wants a path out of this. I mean, we're taking a $2 trillion hit a month. The money runs out to small business in the States by July 1st. So we need some kind of path forward. But I don't see why we're talking about a fixed date for the economy to open when we don't have a fixed date for a path to actually keep people safer from this horrible virus.
Well, John, the president has certainly suggested a fixed date. He wanted Easter, wanted May 1st. The governors have restrictions that go till end of April, early May. In business and a lot of things, you need a date, you need a deadline in order to make things happen. Otherwise, it'll never happen. So there's definitely arguments in favor of it. But I think, as you're hinting, there's some arguments against as well. What do you think?
Well, I just think you need a path forward with dates to make the recovery back to what's the new normal safer. Without a clear public health story, without that, I mean, you look at the example for a Spanish flu epidemic, the last big pandemic. Cities that came back in the West too quickly, San Francisco, a lot more people got sick, and those that stayed shut down until they really had contained the virus, a lot fewer people died. So it's a balancing act.
John, I think, you point back, a lot of these lessons are from 100 years ago or 102 years ago. I think even just you can see this week in South Dakota, which is a state that actually didn't really have restrictions, and you'd say their date is to open now, but they had to shut down the biggest pork producer in the whole country because people are sick and can't come back. So one thing, I think it's just hard to pick a single date because it has to be based on health. And also it's a big country. So just picking one date, especially a symbolic date like Easter, really just doesn't make a whole lot of sense. Now, maybe in a few weeks, maybe there's going to be enough data, enough clarity, we can specify a date. But I think we're both agreeing that right now it's premature. So let's talk about another approach, which is to say, when are certain conditions met? And I think, as you were mentioning, there's some governors. If you look at Governor Newsom on the West Coast, has actually set out some specifics. What are those specific things he's set out? Explain them for us, would you?
Well, they sort of three dimensions. It's probably, I think, a 6 or 8 point plan, and it's going to be more. The most important one is adequate testing and tracing, surveillance of those who are sick. If you look at our country, we are woefully inadequate when it comes to testing capability. I mean, just look at the country, South Korea. I know you don't like Asian comparisons because the societies are different, but they have 8 times the capacity to test based on what they're testing today. So you need the ability to test a lot more Americans than are being tested right now. Tens of thousands and going up to hundreds of thousands of tests. We need to be testing 2 to 3 million people a day. And then we need a surveillance program to monitor them. And we obviously need to make sure that the hospitals and the doctors have the capacity to care for those who are sick. And then we need plans and protocols for all the other components of the economy. They're informed based on the best information from our doctors and public health authorities. But we got to be honest about this real huge testing deficit and go fix it and not run into the same problem we have with ventilators.
Well, I'll tell you, John, Newsom has a number of other items in his plan, like making sure the hospitals can handle the surges and protecting people who are at high risk, and making sure that the schools and businesses can do safe distancing, and having systems to set up and deliver these necessary therapeutics, and having guidelines for different regions when they're going to have to go back to stricter measures. When I look at that, I say, that's pretty darn difficult to do, and it may just never really happen. And I think it's going to be hard. So, John, I was going to say that you can look to Germany and South Korea and so forth, but you can also look to one of those key industries in California, which is the adult film industry. And they actually have had a testing protocol in place for many years, as is often been the case in the digital era, with things like how to monetize the internet and so on. The porn industry is ahead, and maybe we should actually let the porn industry reopen the country and let them run the testing programs.
I think that you cover your part of the economy. I want to focus on first responders, hospital workers, doctors, cops and firemen, food workers, postal workers, the backbone of America, not some of the more colorful aspects of America. They need tests and they need information and they need protection right now. And that's how we're going to get our economy back. There's 130 million people, adults who are working roughly before this hit, and 20 to 40 million frontline essential employees, most of whom are still doing their job without a sense of who's sick and who's not. We've got to get those folks protected through testing and tracing, and then find a way for the rest of us to bring our companies back to work.
So, John, I think there's been a big focus on making sure that we are keeping the healthcare system from becoming overwhelmed. But there is an argument for a broader risk-benefit analysis that doesn't just favor the health system. Now, actually, the health systems themselves are suffering financially because they can't do elective surgeries, which is where they make money. But there's also many people that are out of work, have food insecurity is going up, and there's going to be other big problems down the road. And I think that your point about that people are going to become safer, you can't give any absolute assurances, is just the fact. And we're going to have to learn to live with this virus for some time.
Look, we're going to get through this. We got through Pearl Harbor. We got through the Korean War. We've gotten through the Great Depression. We respond incredibly well post hurricanes and post 9/11. But the leaders that got us through that were honest and believed in kind of the best of America and inspired the best of America. And they didn't start with blame and shame. They started with accountability. And I think we need to open this economy. And I'm not quite sure about your point about healthcare. I think healthcare needed to be the center of focus right now. But everybody needs the economy to start getting back in place. But I think it's not going to be, to your point, until we get a vaccine, we're going to have to manage our way through this time. And we've got the ability to do it. But we have to be honest about that as we start to reopen.
So, John, I think, to sum things up here, I think we agree that we can't go on depressing the economy and staying home forever. We're going to need to feel our way through this with some rational planning and some trial and error. And maybe we're going to get a reprieve, no guarantee, but, during the summer, warmer weather, or maybe with some treatment breakthroughs and even some incremental improvement will make things appear less dire than they do right now in mid-April. So let's wrap up this edition of CareTalk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. We're going to get through this. Thanks for listening.
Hey there, listeners. Want more CareTalk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.